The Hacienda Healthcare rape case made international headlines last year after a patient in a vegetative state was raped and impregnated, allegedly by a facility nurse, then gave birth at the facility without staff knowing she was pregnant. Well, now the Arizona State Health Department is using that as an example of what negative publicity can do to a business as a reason to not release COVID data at long-term care facilities. But the former health department director says the two aren't related.
To elect to use the Hacienda case to flesh out the rationale for that decision seemed puzzling to me.
Former Health Department Director Will Humble has no idea why Hacienda is being included in this lawsuit at all.
It doesn't make sense to use that as the example of what kind of harm can happen because the errors that were made at that facility were so egregious.
In the case of the Arizona media against the state says releasing COVID case and death numbers at long-term care facilities violates state law, and on Friday added that it could hurt facility business by releasing the data. Then they cited Hacienda losing staff and struggling with financial problems after the publicity. But Humble says this isn't comparable at all.
That Hacienda data wasn't part of an enhanced advisory. COVID-19 is. So as a matter of law, it doesn't make sense.
But he does say the state could have a case according to the statute they've now included, which says information shall remain confidential if it's likely to harm a business's competitive position. Humble says there is a point to be made that if a facility has high numbers of COVID cases or death, they'll lose business or suffer future losses. But he says it may come down to how a judge interprets the wording of that statute.
It says substantial harm. So that's the thing about these statutes is what's substantial and what's just regular harm.
Humble says this could become a moot point by the time this court case actually wraps up. The federal government says they're going to be publicly releasing COVID data from long-term care facilities by the end of this month and is done waiting for the states. Brianna Whitney for Arizona's Family.